factors of type 2 diabetes includes consumption of processed foods. Overconsumption of processed foods puts you at risk for type 2 diabetes. Physical inactivity. We live an extreme, with urbanization came the sedentary lifestyle, and even here in Nigeria, when every short distance we want to take bike from here instead of us to walk, we have to find a way to walk more. We have to find a way to move more. So that is another risk factor. Parsley also has been shown to be a risk factor for type 2 diabetes. Women that had elevated sugar readings in pregnancy, which is what we call gestational diabetes. Studies are showing now that within 5 years postpartum, these women tend to develop full-blown type 2 diabetes. So that is another risk factor for the women folk, and of course the black women folk, to take note of, especially after that postpartum phase is another risky phase that they need to be intentional about. So let's go to complications. Now, I'll just jump in one. So, most of the time, most cases that I see, they present when there is a complication. So, I've had some cases that come and they're like, oh, doctor, my wound is not healing. And I've had this wound for 1 month. Maybe a cut that they just, a domestic accident that should have healed. And when we check the sugar, they're having outrageous numbers. Now, first of all, you ask, what are these numbers? The fasting blood sugar of greater than 127 milligram per DL is considered diabetes. Note that there's also a pre-diabetic range between 101 and 126 milligram per DL. So most of the time, with these complications, that we notice it when they present with complications. Some people present with kidney failure, stage 3, stage 4. And that is when we now check their blood sugar and we see that the sugar is very high. What other complication can we have? Strokes. I've had some cases that presented, they just slumped, and they rushed them in, and part of management, we check the sugar and you're having outrageous numbers, 400, 500. So most times, unfortunately, this shouldn't be the case if we are actually assessing healthcare intentionally and going to check our numbers. I've had some people that say, oh, it's not my portion. It's nobody's portion, don't worry. It's nobody's portion. But you have to be intentional. That's just all we're saying. Be intentional.